Hi, everyone. My name is Jamie Thiessen, and today we'll be talking about the development of safety metrics for selected wineries. And the rationale behind this study was to assist growers and distributors and sellers to address some of the health and safety issues that they are encountering on site. And to do that, we have an overall safety equation, which is very loosely based on the Ehrlich equation for sustainability. And for this, we use a scale of 0 to 10, where 0 is the absolute worst and 10 is the absolute best. I would anticipate in this study that most of the final scores will be anywhere from between probably a 4 to an 8, maybe an 8.5. And some of the issues we're looking at here are things like slip, trips, and falls, which have some overlap with other categories such as railings and stairs, as well as housekeeping. Now, there's also some issues with confined entry for facilities that do their own distillation and brewing on site. It's also a problem with some of the more traditional breweries that we see, where the large vats need to have the appropriate signage. Also, in agriculture in the last 25 years, there's been a shift in ergonomics in the sense that there's a lot more sit down stationary jobs, and that presents some different safety issues and some different health risks. We still have people who are going to be working out in the field, who are going to be moving boxes and other items around for shipping and handling, so those concerns still remain. And then also there's the electrical and materials handling, which I think are going to be important whenever you're considering any kind of modern agriculture. So what we wanted to do here was to reach out to different wineries and do a safety assessment of their site, go around and see what's going on, take pictures, that sort of thing. And we currently have 12 wineries that we are working with in this study across 4 states, with some fairly smaller to medium-sized facilities. So we're not working with any of the very large producers at this point. And one of the things that we see a lot with outdoor uh, as well as indoor agriculture is the use of shelves such as these. These are typically either metal or wood, but they also tend to be kind of jittery looking, and mechanically these probably cannot support a lot of weight. But the issue here is you have things that are overhanging, and that's always a concern. This is not a very tall shelf. This photo is taken to scale. The shelf is a little bit skewed in the background here, but you can see how someone might be able to pull on a vine like this, or potentially a trip on a cord like this. This isn't terrible, but we do see more and more of this, and it's a concern that needs to be addressed. I think the issue here would be rodents getting into this box and chewing on some of the electrical equipment, making the installation less effective, and the technology somewhat obsolete. This is also a trend that we also see with some of the outdoor facilities. Electrical box kind of tipped over here, is kind of rusting through a little bit. And also this is a major walkway for this particular site for customers and employees. And some of the weeds here should also probably be trimmed down. Overall, the scores, as I indicated earlier, pretty much kind of in the average to the high average range. Sites that do have a safety plan are obviously going to score better. Sites with leadership involvement are also going to score better. You do need to have both of these existing simultaneously in order to have a more effective approach to total worker health and safety. Also, having proper maintenance and housekeeping is always going to be important for the simultaneous reduction of hazards in the workplace. And also, since a lot of these buildings have been refitted, it's always important to consider infrastructure upgrades, particularly with railings and stairs, and making sure you're up to date in terms of electrical code. Thank you so much for listening to my presentation.
Hello, my name is Jenna Gibbs. I'm the Director of Operations for the Agricultural Health and Safety Alliance nonprofit organization. And this poster presentation is about a project funded by the Upper Midwest Center for Agricultural Safety and Health to evaluate some zoonotic disease exposure reported by students in our Gear Up for Ag program, as well as develop a new curriculum about antimicrobial resistance and zoonotic disease prevention. So, just a little background to this issue. Antimicrobial resistance is a very important emerging issue. We know that livestock workers and veterinarians are regularly exposed to a biological material in a variety of ways. And sometimes, when working with sick or deceased animals or suspected sick animals, the use of PPE is not always reported. There's a lot of science behind this. And also, just a few years ago, calling on Fauci, we know that antimicrobial resistance is pretty much here to stay, and we will never see the threat disappear within our lifetimes. So, a huge critical issue in agriculture as well. So, our methods for this project were first to develop a new curriculum within the Gear Up for Ag Health and Safety program to be delivered to college agriculture students about zoonotic disease prevention, as well as how some zoonotic diseases can be resistant. We did this through a partnership with the University of Minnesota. We identified a veterinary resident. His name is Gus. He now works as an EIS officer in Los Angeles area, but he did a great job helping us find evidence-based content to be added to our program. And the new curriculum was about 20 minutes long. Throughout the last year, we were able to deliver this curriculum to many students, both virtually and in person, thanks to the pandemic. Our organization has another great presentation about how we moved to a virtual platform. We really used two methods of evaluation for this project. The first one is quantitative. We always pre and post survey our students, and our pre-survey was a great place to insert a couple questions about zoonotic disease exposure and common tasks that the young adult livestock workers were doing that could involve exposure to biological material. And then, of course, we also use a lot of qualitative data collection. This is sharing stories, sharing biggest lessons learned, and we have an evaluator who takes notes over that type of data. So we're excited to use both forms. In the last year, we were able to deliver the zoonotic disease prevention training to almost 300 students in the US, and 90% of those did fill out a survey questions about zoonotic disease exposure. Of those, livestock workers specifically, 12% reported zoonotic disease. Now, eventually we thought this was pretty low, but we realized that a high proportion of those students, almost 1/3, also reported that they were unsure if they had a zoonotic disease exposure or not. When we looked at some of the agricultural tasks that these livestock workers were performing, the most common one, interestingly, was administering pharmaceuticals and handling sharps. That was even reported higher than working and moving large animals, which was surprising to me. And what's interesting about all these tasks is we also asked them if they were doing them at a really young age, younger than 14, and to the most degree, they were even handling sharps. 67% of livestock workers reported that they were doing that before the age of 14, which is very interesting. Next, we also heard a lot of interesting stories and feedback, qualitative data from these students. And we learned a lot that it's really hard for these young workers to know if they had zoonotic disease or not, because a lot of times they don't seek medical care. So this is a great quote that just shows that this young man from Iowa had just gotten sick after working with his animals all day. So he suspected it was an illness, but he didn't really go to his doctor. We also heard a lot of interesting stories about sharps handling, and most of these stories focused on being in a hurry and having to administer vaccinations or medicines to a lot of animals in a really short period of time. So we heard some stories about dropping needles, not wearing protective boots when handling needles. And then, of course, this scenario was just so crazy. People putting used needles in their pockets as they walked back to the barn, which, of course, is a really, really high risk. So our next steps in this project is to really take this zoonotic disease prevention training that's about 20 minutes long to a more international scale. We have ongoing talks with people in Europe and Eastern Europe and talking about if the diseases are similar or different there. And we also want to spend more time on actually defining zoonotic disease and what those symptoms look like and feel like so people can learn a little bit more about that. For example, a lot of students didn't know ringworm technically was a zoonotic disease, but when we talked about it in class, they realized that that was pretty common. And then also focusing on personal protective equipment and how it can be used when handling especially sick or deceased animals or working with those biological materials. And then lastly, we recently applied for a grant proposal to take this type of Gear Up for Ag training specifically to large animal veterinarians and techs and assistants, since they are also really key stakeholders in the prevention of zoonotic disease and antimicrobial resistance as well. So we just would like to give a big shout out to our partners. Obviously, the Upper Midwest Center, they provided a lot of funding for this project, so we are excited to work with them. And then also, we're really thankful to 3M and Compere Financial, because when we do these Gear Up for Ag trainings, it's really important to provide the students with a personal protective equipment kit. That's a really big incentive for these students to pay attention and attend and participate. So that's all for this presentation. If you have any other questions, feel free to contact me. My email is here on this video as well as on the poster. And thank you for listening today. I hope everyone has a wonderful conference.
Hi, my name is Jill Kilinowski, and I'm part of a team led by Dee Jepson. Also members are Emily Drupp, Patricia Brinkman, and Sonia Duffy. And I'd like to talk about our health behavior survey of Ohio farmers that we conducted. So what we did is, as we know, is that there's no current needs assessment of Ohio farmers on their health behaviors, and farmers are at a higher risk for work-related injury, and there's been an increased obesity rate in farmers. Our research study had two components. The first was surveying healthcare providers, agencies, and institutions on what kind of services they offered to farmers, whether it be through extension or different programs that they may have. And then the second part was the self-reported health behaviors of the farmers themselves, which I'm going to be talking about. So the objective was to look at these health behaviors, and they were 8 of them: sun exposure, sleep, physical activity, nutrition, mental health, tobacco, alcohol, and illicit drug use. So the survey, we use a Qualtrics survey, and we use reliable and valid questions and questionnaires and scales that have already been established. It took about 20 to 30 minutes to complete, 40 questions, 7 demographic questions, and 2 self-reported anthropometric questions. We had 505 participants. We had basically, they were male, married, or with a domestic partner, white, non-Latino, and worked in the farm full-time. The distribution of farm commodities was about 75% of them had field crops, and about 36% of them had livestock production, and the rest were distributed over various other farm commodities. When we asked farmers working outside in the sun, you can see that the greater majority of them spent 6 hours or more working in the sun. And we asked this question over summer, spring, and fall, over weekday and weekends. The next question asked about sleep and sleep hygiene, and most farmers said that they slept 7 to 8 hours a night. But when we used the Sleep Problem Index 1, which looked at various other aspects of sleep, we found that farmers did have a problem. About 90% of them had a problem sleeping, various aspects of it. So this needs to be investigated further. We asked, we were concerned about mental health, and about 10% of farmers scored 3 or higher, that indicates a major depression order is likely. We asked about healthy eating and physical activity, and farmers did not meet the recommendations that have been established by the Health and Human Services for healthy eating and or physical activity. We asked farmers about tobacco use, and about 80% said they didn't smoke. And when we went further and looked at the data, those that did say they smoked, we found that 84% of them were classified as low smoking addiction, and that about 16% had moderate smoking addiction. The next question we asked was about alcohol usage, and 69% of them said yes, that they did consume alcohol, and that was just the very first question, do you consume alcohol? And when we again looked further, we found we used the Audit C score, which looks at hazardous drinking, and we found that of those that could be scored, 31% of men and 28% of women could be categorized as hazardous drinkers. We asked the question about illicit drug use, and 4% said that they did use illicit drugs that were not prescribed by their healthcare provider, and 3 said they preferred not to answer. We asked people to report their height and weight, and as you can see is that it was distributed over men and women, and the greatest percent of the prevalence of obesity and overweight was in ages 55 to 64, which needs to be addressed. So what does the study indicate in indicating future concerns, future research and concerns? Well, that most farmers did have a problem sleeping because 90% of them scored greater than the midpoint of the subscale that we had used. Mental health, 10% of farmers had a positive score for a likely depression. So they do need to be concerned over mental health of farmers. Fruits and vegetables are less than the recommendations of the dietary guidelines for Americans, and physical activity, the physical guidelines for Americans as well. Audit C indicated that 1/3 of males and more than 1/4 females can be categorized as hazardous drinkers. So that poses a problem with safety on the farm, and that obesity was prevalent. So what are the conclusions and takeaways? We learned a lot of lessons about accessing our target population. We had innovative methods to respond to the COVID-19 limitations when the state was shut down. About formatting questions in Qualtrics and what the data really tells us. And then again, working with a multidisciplinary team and style. So indications for actions is that this will allow us to look at what we found and then go to Extension and other agencies that they can match programming. And this is really important, that their programs are what the farmers need. Questions and contacts, these are our contacts, and we'd be very happy to answer any questions for you.
Thank you for joining us today. My name is Megan Sauer, and along with my co-author, Marcia Salzuito, we will present on Tools of the Trade, Lessons Learned. Agriculture is one of the most dangerous industries in the United States. There are numerous resources available to address agricultural hazards, but many are underutilized because producers and agricultural organizations may be unaware the resource exists or have an unfamiliarity of their application. There is a need to develop a strategy to introduce producers and agricultural organizations to farm safety resources and demonstrate how to use them. The goal is to conduct and evaluate the effectiveness of these sessions to determine if they increase participant awareness of hazards and motivate them to use the session resources and activities. Originally, the sessions were conceived as live, interactive sessions where lab facilitators would assist participants with using these resources. Due to the COVID-19 pandemic and the resulting transition of conferences to a virtual format, the format of the sessions were revised to virtual booths that would include a video demonstrating a safety resource and handouts that describe the tool, how to access, to build, rent, or buy the tool, and activity sheets enabling participants to practice using the tool. Recruitment for virtual learning labs for the 2021 ASHCA Summit began in January 2021, with openings available for 25 virtual labs. Invitations extended via email included information on the requirements for session content, availability of technical assistance, and additional future applications. Evaluation of the sessions will use data collected from 3 sources: conference evaluation survey sent out after the event, survey of lab facilitators sent out 2 months post-event, and a follow-up survey of participants conducted 2 to 3 months after the event. Sessions were renamed Tools of the Trade, or TOTS, as the name is more attractive and descriptive. While the TOTS booth were available throughout the event, there were also designated times for these sessions when facilitators could interact with participants, and the booths were available on the conference website for 30 days after the summit. 16 organizations accepted the invitation to create TOTS, resulting in 18 total TOTS, showcasing a variety of resources, including online tools and hands-on demonstrations. Organizations hosting TOTS booths were also emailed after the event for permission to include their TOTS materials on a dedicated web page and to include the materials in future events. Additional results will be shared at the conference after survey results are complete. Resources and tools can be used by producers and organizations to educate agricultural organizations, producers, and their families on how to address risks and hazards in the work environment. Learning lab sessions can be added to other industry conferences, such as insurance, banking, and other producer conferences to educate workers, clients, and others in an interactive and fun manner. Increased use of these resources will help mitigate hazards, resulting in fewer injuries. Thank you for watching our presentation today. If you have any questions or thoughts or would like to connect with us, you can reach us on any one of our communication platforms. Thank you.
Hi, I'm Carolyn Sheridan, Executive Director and founder of Ag Health and Safety Alliance. Oh, and welcome to ISASH 2021. I'm going to be doing a short presentation about our poster, Lessons from a Respirator Fit Test Capacity Building Project. Like many of you in 2020 and also parts of 2021, we found ways to adapt our live on-site programs to the virtual world on Zoom, and here we are on Zoom for ISASH 2021. In 2017, changes to the EPA Worker Protection Standard went into effect, and those changes included a requirement to provide handlers with respirators, fit testing, training, medical evaluation whenever the pesticide product requires the handler to wear a respirator. This included family farm operations. This new requirement for fit testing really did present many challenges because of limited fit testing options across the state, but also in many states in the nation. We had already begun doing this kind of respirator fit test training in person with the agro-medicine courses at the University of Nebraska Central States Ag Center and the University of Iowa with the Great Plains Center for Agricultural Health and Safety. So we already were doing respirator fit test training, but with the pandemic, we still had that need to train individuals to learn how to do respirator fit testing because that requirement for fit testing did not go away. So in the fall of 2020, our organization partnered with the Iowa State Extension and Iowa Center for Agricultural Safety and Health, or ICASH, to host an online respirator protection fit test. So this required some adaptation to the program that we had already developed and develop a new agenda, deciding how would that fit into the online platform. So our methods included using the virtual online sessions on Zoom, having participants interact on the chat box, using their microphones, and participants were sent fit test kits and respirators because they did need to practice. And the participants were required to have on their cameras. And I know it was difficult for some of them because they were not accustomed to having their camera on and talking through their microphones. But the fit test practice portion of the workshop really was critical. And then they also were required to have to return demonstrations with a partner. So that meant if you were doing respirator fit test training, you had to identify somebody else who you could also have demonstrate your respiratory fit test skills. And we also had to observe many COVID-19 protocols at those facilities. You can see in this picture that some of the people have masks on. And so we had to talk about how you can do respirator fit testing with COVID-19. We also had to make sure that they had the equipment necessary, as I just said, have it all laid out, be well prepared, because the course or training was about 4 hours long, including the demonstration. So the outcomes were great. We did increase the geographical capacity. The 33 individuals were trained in August and October. We reached people in 23 counties. These were safety and health professionals, extension professionals, and so it was a great group of people. And we did pre and post tests, and 100% who completed the post survey indicated they now understood the importance of respirator fit testing and in their professional role. And 75% felt more confident initiating conversations with this population about respirators. So this is a great map. We like seeing this expansion of the capacity of respirator fit testing. So what are our next steps? Well, I'm going to back up this slide a little bit. We're going to do some revisions to the fit testing capacity building guidebook. With having online capacity to do virtual trainings, we have identified we need a few more resources. We need to continue to offer virtual training workshops. It really does expand capacity. We know people cannot always travel. There's not a good travel budget. It makes really good use of people's time. And there's some new training opportunities, pharmacy staff, pharmacy students, there's other groups. So the Gear Up for Ag online program that we have for our Gear Up for Ag program, we're also going to make good use of that for this program. It is a great place for people to be able to sign into for resources instead of receiving an email with like 15 attachments from me. So we also had a really unique thing happen to us just in the month of May. We learned that long-term care facilities now also have the need to provide respirator fit tests for all of their employees due to COVID. And they really are struggling to get enough people trained to provide the respirator fit testing. So I've been doing some work with Brandy Jensen at ISASH again to help deliver these types of programs. And we can't discount the fact that many of these long-term care facilities are in rural areas, and they also could be a great resource for respirator fit testing to the agricultural population. So we really do want to thank our partners, ISASH, also Iowa State Extension, and I also want to thank my team who helped put together this program. Certainly looking forward to finding many ways to teach people virtually. So thank you for listening to my presentation related to our poster. We also have a technical paper. And I just want to say at the end, this has not been an easy Zoom for me and an easy recording. So, hey, reach out, like us on Facebook, like us on Instagram, send us a message. I'm pretty happy to send you the blooper type of presentation that I did, which took about 15 takes to do both. But anyway, I miss all of you. Wish I could see you in person at ISASH 2021.
Good day, and thank all of you all for being here at the ISASH conference this year. I'm very pleased to be able to present my pilot study investigating the mental health of female farm operators. I also need to thank the Southeast Agricultural Health and Injury Prevention Center for funding this project. My purposes for this study are listed here. My overall goal was to provide more information about the mental health of women who operate farms. This audience is well aware of the alarming rates of depression and suicide in production farmers. And we all know that there are factors that are unique to the occupation of farming that contribute to high rates of stress and depression. And in addition to increased rates of suicide, increased levels of depressive symptoms and stress can not only increase that farmer's risk for injury, but also increase the risk for the development of chronic disease. And all of these can impact the farmers and the farm family's quality of life. Why should we even explore farm women as a different population? Well, men and women respond differently to stress. And we also know that in the general population, women have higher depressive symptoms. And in addition to the stressors associated with farming, women who operate farms may also have additional stress due to their gender role within the culture. The methods are as listed here for this cross-sectional multi-method pilot study. This includes non-parametric statistical analysis. The 13 female farm operators represented here in this study are from 2 geographical areas of Kentucky and 1 area of Tennessee. All were white and all but 1 were married. Their ages range from 28 to 64. The female farm operators in this study reported a great deal of satisfaction from their farm work, and most had CESD levels less than 16 and had reported low overall levels of perceived stress. The Spearman's row revealed a statistically significant relationship between CESD level and hours performing farm work, where CESD level decreased as hours performing farm work increased. A positive relationship was also noted with CESD level and numbers of hours working an off-farm job. In addition to the stressors known to be associated with farming, like unpredictability of income, increasing operational costs, increased government regulation, the major themes that emerged with the interviews in order that were reported by the women were lack of respect from their male counterparts, lack of physical strength to perform some tasks, and multitasking. The multitasking included the continuation of the majority of household tasks and childcare, and in some cases, this was in addition to holding an off-farm job. Without a doubt, the most common theme regarding coping mechanism was faith and prayer, followed by talking with a friend or spouse, and lastly, stopping to regroup or replan. All of the women were able to identify when they would seek help for their mental health, and without hesitation stated that they would seek help at that point. There were some limitations to this study, small sample size, and it was a cross-sectional study which only represents a single moment in time, and these results could be different depending on the season of the farmer's year. And there was also underrepresentation of women of color and women without partners, and this of course limits generalizability. But despite the stressors of being a female farm operator, women who operate farms are satisfied with their occupation and are generally happy. The results do suggest the need to continue need to study the differences between men who operate farms and women who operate farms. The study reflects the female farmers' positive ability to cope with stressors. And so a strength-based study to further explore the female's ability to deal with stresses of farming is needed, and the results could potentially benefit all farm operators. Additionally, the results suggest that interventions aimed at improving or maintaining the mental health of female farm operators could be faith-based or involve social interaction.
Thank you for attending what would have been an educational display session, where we will be highlighting our Farm Safety Project book and a Learning Lab kit. My name is Dee Jepson, Professor and Extension Safety Specialist at Ohio State University.
Hello, my name is Jane Wright. I'm Interim Assistant Director of Extension Publishing.
We have a new product that we're really excited to share with you, and it's for the non-formal educational settings. This resource was developed from the Safety in Agriculture for Youth grant funded by USDA NIFA in collaboration with Ohio State University and Penn State Extension. The Farm Safety 4-H Curriculum Guide and the Learning Lab Kit will soon be available through our SAY Clearinghouse and also included as one of our hands-on learning products through our Extension Publications unit. Jane, why don't you tell us a little bit about a Learning Lab kit?
Okay, I will. I'm so excited about Learning Lab kits. Let's start with a basic description. They are sold by The Ohio State University and are focused mainly on livestock and companion animals. I like to think of them as high touch and low tech. Sometimes they are a very welcome relief from single user computer-based learning. This is an opportunity for youth to work together, to have to actually touch learning materials and move them around. Shown here is the dog kit, and this is kind of a typical kit. There are lots of posters included in different size materials. I want to point out that last sheet way in the back there is comprised of tags that get broken apart and then match some of the activities. The important thing, though, is that these are laminated. They're very durable and long-lasting. They can be used for learning and evaluation. And the activities are also scalable, meaning that you can reach different age groups and different skill levels. Let's take a closer look at just a couple of activities. And I realize, of course, these aren't farm safety, but the interaction and the thinking behind them typify many of the activities in all of the kits. One is parts identification. In this case, it's parts of the skeleton of a beef animal. We're looking at the poster with the answers on it, but if you flip that poster over, it's the same exact image without the answers there. And learners use those tags that are shown to move around and identify which part is which. I'm sure you can understand that there's a lot of value in kids being able to move them around and play a little bit until they get answers that they're satisfied with. On the right side are two activities from the GOAT Learning Lab kit. The top one has to do with injection sites. That's an actual syringe that comes with the kit. Learners can use that syringe to indicate the appropriate injection site on a goat animal. Down below is a set of breed cards and the corresponding tags. So those can be used any number of ways, but the typical way would be to lay out the cards or a few of the cards and ask students to identify the breed. With those pieces in mind, I'd like to review a little bit about what makes a typical kit. Posters, pictures, charts of the kinds that you've just seen are included. They're done on bright cover stock with heavy-duty lamination. They come with scored, color-coded punch-out tags. We include heavy-duty plastic bags for storage so that you can keep all these materials straight and use them over and over. The kit is delivered in a sturdy cardboard mailing box that actually becomes the storage box when it's inserted into the canvas bag. Finally, the largest piece in the kits is usually a poster, and those measure 26 by 20. The Farm Safety Learning Lab kit is a little bit special because it also includes a curriculum guide that includes background information and more activities. What activities, you might be asking yourself? Well, we're planning on including 22. Dee, you want to give us a closer look at some of those?
Sure. All of these activities were developed from various curriculums and different teaching methods that are commonly found in safety and health training programs. So for example, the participants can show what they've learned by matching laminated hand signal signs with the descriptions that match those. We also have a scenario activity where we've developed 10 realistic stories. The participants can read those scenarios and then get into a discussion about the risk factors that they hear are included in those scenarios, common factors that could be encountered on their own operation. Another activity utilizes that interactive content that many of you are familiar with at the cultivatesafety.org website. We've collaborated with National Children's Center to print 48 task cards. On these laminated cards, the participants can match the hazards with their protective factors using those little Velcro dots that Jane was explaining earlier. The teachers can choose which tasks to interact with, whether they want to focus on animals or specialty crops or what have you. And they really complement what's in the kit and the type of tasks that the youth might be doing. Certainly, we couldn't address all of the activities that are in our learning guide. Everything from tractor parts identification, like what you saw with the animal parts, we have a tractor parts identification, some universal color controls, and even down to some front end loader positions, and lots of fun wrapped up into these kits. So the content necessarily isn't new, but how we've packaged them and made them available to you as a learning lab kit will certainly complement your agriculture safety and health training programs.
Thanks so much for listening. We're very glad to be here. If you have any questions at all, please contact Dee Jepson or me, Jane Wright.
Hello, and welcome to the Ag Safety for You 2.0, an online training program presentation. My name is Aaron Yoder, and I'm an associate professor at the University of Nebraska Medical Center in Environmental, Agricultural, and Occupational Health. Today, we're going to talk about what the program is. So it's an online certificate course that provides a digital badge to those who take it and complete all the sections. The course itself provides an overview of the hazards common in farms and rural agricultural businesses. It's based on the National Safe Tractor and Machinery Operation Program, as was the first version of this course. It has a few additional extras added to it. It is a joint effort between the University of Nebraska, Penn State University, and the Ohio State University. The learning goals and objectives for this course are closely parallel to the NSTMOP program, where we have a first module that takes a look at the introduction to different types of agriculture risks and regulations related to those. Some safety basics, as you can see there, looking at injuries and age-appropriate tasks, a little bit about clothing and personal protective equipment, and just getting started in some of the safety basics. The third module takes a little deeper dive into agricultural hazards, some of the mechanical hazards, and other hazards that exist with animals, electricity, confined spaces, and other chemicals. The fourth module takes a look at tractors and some of the hazards and how tractors function and how that relates to safety and health. Module 5 takes a look at connecting things to the tractor, looking at how we use different types of implements, whether they be drawbar or three-point hitch. And the third module takes a look at materials handling equipment, things like skid steers, ATVs, and utility vehicles. The course has evaluation built into it. At the end of each module, there's a quiz with some tested questions that we have in a question bank. And then you need to pass each of those with a 70%, as well as complete a survey at the end to get issued the certificate and digital badge. The best way to find the course is to go to your favorite search engine like Google and type in Ag Safety for You. You'll see a few things pop up because we do use that for our Facebook, YouTube, and Twitter programs that support this and support our functions inside of e-extension. But the first one that normally comes up is the certificate course. You click on that, it takes you to a page with more information inside of e-extension, tells you how to register. You can see we have bulk discounts for those that are interested in multiple purchases. After you register, you head into the course. You can see our 6 modules there, the survey and the certificate, all different parts of it. It does explain it again and how you can get more supporting materials for the course. If you'd like a book to go through as you're taking it, you can find the NSTMOP book, which supports the questions and the content of the training. When you click on lesson 1, it tells you the different parts that are in there. The numbers beside it are the task sheets that go along with the book. You can see there's an ebook lesson then. Once you click on the ebook lesson and walk your way through it, then you can unlock the quiz. As you can see there, it says restricted now because we haven't been through lesson 1. And then within the lessons, there are different activities. We've added some interactivity into it, like the mechanical hazards one at the bottom of this page, where you match words to different definitions so that we know you have an understanding of those, and they'll be tested anyway in the quiz at the end. Once the course is complete, you're given a digital badge. Here you can see the information about that, the image and some of the information that's hooked to it, the criteria it took to obtain it. As digital badges do these days, they have that information in there. So with that, I'm going to end. And if you have any questions, feel free to email me and let me know if there's anything I can do to help you use the course, take the course, or tell others about the course. Thanks for your time, and have a great day.